Right. So I was going to post my information in the chat, but I will just share it verbally. Hi, everyone. I am Jen Martinek. My pronouns are she, her. I'm the Strategic Business Partnerships Manager at CareOregon. Our work oversees a number of things, including health-related services, policy, and governance, and we also oversee non-emergent medical transportation with the 3 CCO regions that we serve. We also have another arm of our department that focuses on tribal care coordination. So there's a lot that our department does, but I am here, of course, today to talk about some of the partnerships that we have set up using health-related services for Veggie Rx. And as soon as I can figure out how to do that, I'm going to share my screen. I'm very familiar with doing this in Teams and not Zoom, so bear with me just a moment as I figure that out. Let's see. Okay. And I thought I had it. Here we go. All right. Are you able to see my screen?
That's looking great.
Excellent. All right. Let me just move the presenter screen so that I can see that and also look at you all. All right. So we're here to talk about health-related service funds for Veggie Rx. I've got a few major points that I wanted to hit based on some of the questions that you all submitted. Thank you so much. That really made it easy for me to focus what we discussed today. So of course, we're going to go over what are health-related services. I imagine many of you already know at least briefly what they are, but I'll cover just a few points. We'll talk about request workflows, why we've decided to engage more directly in food supports, some of the challenges and sustainability issues that we've faced, our partnerships in general, how to build a CCO partnership, which I will say I don't have any magic wand for. And then we'll also talk about the 1115 waiver. So, of course, health-related services, as many of you already know, are typically non-covered services or sometimes non-billable services that are meant to supplement covered services. So when we're talking about covered services, of course, we mean things that are traditionally covered by health insurance plans, whether that's the Oregon Health Plan or other types of health insurance plans or CCOs. And they're meant to improve outcomes for an individual or the community. And so when we're talking about health-related services, I think it often gets conflated with the individual flex requests. But there are actually 2 major types of health-related services. There are flexible services that are meant for an individual, and then there's also community benefit initiatives, which are meant to benefit the community as a whole, as you might imagine. So when we're talking about flexible services or flex requests, that's often referring to something like an individual member is requesting a CSA box, or they're requesting assistance with a cell phone or something like that. Whereas community benefit initiatives are oftentimes benefiting the community as a whole or a larger population rather than just one single member. And they can cover both members and non-members. So it's a little bit more flexible, and we've found a lot of really creative ways to engage in trying to cover different populations based on their needs. Let's see. One of the questions that had come up in the questions that Shin had sent me was about whether health-related services funds exist in other states. And they do in some ways. Oregon seems to be fairly unique in the way that we offer health-related services. This was really part of the 1115 demonstration waiver that we had submitted for the 2017-2020 period, and I'll get into that a little bit more in the later slides. And for health-related services in Oregon, we do offer them for Medicaid members, but not for Medicare members. And it's been a little bit confusing as well because there's an assumption, including by myself when I first began this work, that a member who was not enrolled with a CCO could also access health-related services, and unfortunately, that's not the case. So if a member is fee-for-service, they're just enrolled directly with the Oregon Health Plan, but not with a coordinated care organization, then they wouldn't be eligible for health-related services. It's a unique portion of the health plan operations that CCO members are covered for things like this, and CCOs are able to use any surplus funding or profits from their operations to be able to cover health-related services and then submit for reimbursement. All right, so regarding traditional request workflow for Veggie Rx, I tried to focus on the Veggie Rx workflow in particular. This is a little bit different depending on the type of request, but this is a pretty generic workflow for Veggie Rx. So there's obviously a lot of steps here, and it can be very complicated for folks to try to navigate initially. So of course, the first step is that a clinical partner may identify a patient or a number of patients that need to engage or want to engage in this program. They will then, of course, engage with those members, and with the members' assistance, they will work on filling out the health-related service flex form. Sometimes the CBO partner will also be involved in helping to submit that form. For example, with two of the partners that we've worked with, we helped create some templated language to ensure that the clinical partners and CBOs had the right information to be able to auto-approve those requests as they came into our processing teams. Then once the form is submitted to CareOregon, CareOregon will review the request, make sure it has at least base level information. Because we have templated language, it hasn't been a significant review process, and we do already authorize that those are auto approved. So they basically just move through as long as we have all the members' information and everything is completely filled out. So it's just a quick review process. From there, CareOregon will submit the request to Project Access Now through the Track Via system. A voucher will be generated, and that is typically sent to both the requesting provider and to the CBO. The patient usually enrolls then in the Veggie Rx program once we've identified that, yes, that member is in fact approved. They will then engage with the Veggie Rx program, and later on the CBO will invoice Project Access Now. We'll get into this in a little bit as well, but Project Access Now is the one that holds the vendor relationships and the contracts with the individual CBOs. CareOregon has stepped out of that space in more recent years. And then Project Access Now will make payment to the CBO, and Now will invoice CareOregon. And from there, CareOregon will use that invoice to populate what we call the Exhibit L report, or the L report for short. We work with a couple of different types of nonprofits. For example, we work with Adelante Mujeres, who really was one of the first organizations that we got set up with in 2020 with the help of Kaylee Summers, who I saw is also on this meeting and has helped set up this connection as well. And we worked with the CSA Partnerships for Health with Zenger Farm. And we've really found that these partnerships have made it so much easier for us to get better engaged in and understand some of the processes around Veggie Rx and CSA partnerships. It's been a really valuable relationship in the last couple of years. Regarding the member view, we have a much simpler process. So from the member perspective, it's pretty easy and simple. They honestly are not engaged in it much at all. They, of course, have to engage with the healthcare provider and, make sure that they're helping to fill out the form with whatever information is needed there. When the request is approved, then the member would enroll in the program with the help of the requesting provider and the CBO. We have a regulatory requirement to send an outcome letter for health-related services. So we would then send a letter letting them know that they've been approved, which ideally by the time they receive the letter, they should already know anyway, because we have to send it via snail mail. And from there, the member would engage in the Veggie Rx program. That might be via cooking classes or going to the farmer's market, whatever the case may be for the individual program itself. And then lastly, depending on the program, they may be involved in program evaluation efforts. So they might be asked to participate in a survey to advise of their experience and anything that might be able to be improved for future. Sorry, my dog. Anything that might be able to be approved or improved for future program iterations. All right, so next up, one of the questions that was asked was, why did CareOregon prioritize food supports for their members? And that's a really good question. And I had to spend a little bit of time thinking about, how did we get here? And ultimately, I think it was a number of things. Our previous engagement with CSA and Veggie programs was really just via grant funding. In early 2020, I remember receiving emails from Sean DiCarlo, who is I can never remember his title, but he was basically the person overseeing grants. And he had been working really hard to get our team connected with folks at Adelante and at Zenger Farm. And so we started building those connections. Of course, in 2020, we all know that there was a major event in the way of a global pandemic. And so there's a number of things that were really sidelined. We saw that food support was no longer being focused on as much. Everyone was focused on trying to provide COVID-19 related supports. So we really saw that there was a lot of increased rates of members who were saying that they didn't have access to food. There was a lot of fear of going out into the public and out into the grocery stores. I know I myself was a little bit concerned about that too. There was a lot of school closures that then resulted in paused or eliminated school lunch programs. There was, of course, a lot of issues with broken supply chains. And so it really seemed like it was a great time for us to step in and try to build up these partnerships. And of course, Adelante Mujeres and Zenger really stepped up in a big way by offering delivery to members and trying to work with members as much as possible to figure out how can they continue to support them during this, I hate to use this term, but unprecedented time. So this was really a good opportunity for us. And since then, we've really just tried to figure out how we can continue to offer food support. One of the things that we realized, of course, is that many of our members, while we were trying to approve individual flex requests for a single member, most members don't live in a vacuum. They have other family members that are also impacted by the similar food insecurity issues. And so any of the requests that we were approving were ultimately approved for the entire family rather than for just the individual. Let's see. And I'm happy to stop and pause if there are questions. So I see that there's something in the chat, but I wasn't sure if it was a question. All right, well, I'm going to, Kaylee.
Oh, I was just going to say, I don't see anything in the chat. I apologize. I can't.
Okay.
So, yeah.
It might be someone introducing themselves, so that's fine.
Never fear, though. We will have plenty of time to answer questions, and I'll try and monitor that if there are things that come up too.
Sounds
Thanks,
good.
Jen.
Of course, thank you. All right, so with our Veggie Rx programs, there's certainly been a number of challenges, and particularly with trying to engage on sustainability of these programs. So some of the things that we've heard from our CBO partners and from clinical healthcare providers in general is that this process introduces a high level of administrative burden. And so one of the things that we had focused on early on was trying to create templated forms, auto approve those requests, make it as simple as possible. Of course, the form does still need to be filled out. It is still a little bit of a challenge because I have to wait on our team to process the request. And even though it's auto approved, it can still sometimes take a little bit to get processed. So there are still some considerations there that we need to work through and how we can make this easier over time. Having dedicated staff was definitely something that came up quite frequently, especially in the last year. We all have seen significant staffing challenges in many, many industries. So not having folks, whether they were CHWs or THWs, directly engaged with members or other dedicated staff helping to support these requests and workflows definitely make it a little bit harder. Of course, with individual flex requests, we also have the added challenge of the fact that it's meant to cover the individual item or service that's being requested. So if it's a CSA box, it would cover the cost of that CSA box. So we've had to come up with some creative solutions on how we can incorporate some administrative costs into the flex request as well. We also have seen that there's varying interpretation of requirements. If you ask someone at OHA or another CCO or even another health plan within the health share umbrella, the odds of someone having the same interpretation as CareOregon about how to cover a Veggie Rx program, it's going to be different. And so we have certainly struggled with finding alignment between CCOs and health plans and even OHA to ensure that, we're all doing this in a consistent way. Program evaluation is also not typically part of health-related services. And so that's been an interesting challenge with some of our programs as well. With many of our programs, there was a program evaluation piece already embedded into it. But with one of our newer programs with Mudbone Grown, there was no program evaluation already set up. They were just recently starting the CSA partnership. They didn't have the mechanism to really engage with that. And we've seen that in other health-related services programs that we've set up as well. Program evaluation is often an afterthought, but of course, how do you really ensure the success or identify process improvements if you're not also evaluating the program? So that's certainly been a challenge. Regarding sustainability, there are limitations on the ongoing requests. Of course, we'll touch on this in a little bit as well, but and again, relating to the alignment piece between CCOs and health plans, we've seen that while CareOregon is rather permissive and allows longer requests or longer duration or repeated requests, not all health plans or CCOs share that sentiment. And so some will put a pretty strict cutoff point at a certain duration of time, or they may provide funding for food supports up to a certain dollar amount. So there are definitely other restrictions that CCOs have implemented. There's a challenge with health-related services that they're intended to be funding of last resort, but trying to figure out who actually is the funder of last resort is also a challenge. So many organizations are really just unable to provide funding for these types of services, and trying to figure out who is on first to cover this is definitely a challenge and something that we're considering long-term. Like, how do we ensure that we continue to keep an eye on who the funder of last resort is, and how are we making sure that we're spending Medicaid funds responsibly? There are also some barriers and opportunities for self-sufficiency. So some of the barriers, for example, might be other social determinant of health factors that might make it difficult for a member to actually spend their own money. Say they've had difficulty maintaining a job, and so they don't have the ability to continue to purchase food on their own after the end of their involvement in a particular program. So that might be one barrier for them to become self-sufficient. There's also some opportunities here. So some of the things that we've been thinking about is engaging with other types of CBO partners to see, well, if someone has engaged with the CSA program, for example, would they then be able to use another type of program to grow their own food or something else similar? So there's a lot of potential opportunities, but we don't have a solid pathway at this point. All right. So regarding CareOregon partnerships, there were several very good questions that came up. One of them was, why work with CBOs? What values do you share with partner organizations? So regarding our mission and vision, as you can see here, our mission is to inspire and partner to create quality and equity in individual and community health. And our vision is healthy communities for all individuals, regardless of income or social factors. So as you can see in both of those, there's really just a significant focus on community health and engagement. And we really try to partner with local organizations that have already built that trust within their community and the members that they serve. We also recognize that CareOregon doesn't know everything about how to do every program. And so we want to ensure that we're working with those organizations that are, in fact, subject matter experts. They excel at the things that they do, and we might excel at other things, but I don't know the first thing about setting up a CSA program, and there are many organizations who do. So we want to partner with those organizations that already have experience and understanding of those types of programs. And so we really assist with the partnership development and payment processes and helping to set up those connections. And that's really what we have learned that we excel in. Some of the other questions that had come up as well was, can you explain more about the function of Project Access Now and why we don't just pay the vendor directly? And I would say that it's very similar to what I've already shared. We understand that Project Access Now is already a trusted entity in the Portland metro region and across the state of Oregon. They really excel in providing different types of services through their C3 CAP program. And so we found that it's much easier for them to focus on building those vendor relationships and contract with the vendors and make payment than it is for us to do so. We will still pay them for the services that they provide, of course, but we found particularly in the end of 2019 and 2020 that we as CareOregon didn't have the staff or the resources to be able to do that all ourselves. So we found that partnering with organizations who can do these things better than we can really benefits the community as a whole. Let's see. Okay, so regarding building a CCO partnership, there were some questions about, what advice I would give to this group or individual programs about being a feasible partner, and what we should do or what you should do to reach out to certain CCOs staff to try to engage with them on a Veggie Rx program. And as I mentioned at the beginning of this presentation, I don't really have a magic bullet or wand for this. There's really no wrong path. And so, as I mentioned earlier too, each CCO has its own ways of managing partnerships. In some cases, there's grant funding that is used to fund those programs. There's also contracted programs, and those may be contracted directly with the CCO, or they might be through a third-party vendor like Project Access Now. And then we also have health-related services. And sometimes it's a combination of all three or multiple of those items. So it really depends on what best works for each individual Veggie Rx CBO. For some folks, they just need a little bit of financial capital, and so grant funding works. For others, they need a little bit more support, or they might want to do a little bit of a mix. And so trying to identify the best pathway for those stakeholders that are involved is very flexible, depending on the needs of the community as well. Regarding CCOs, we're required to offer health-related services, but as I've already mentioned as well, the process and the requirements and the resources really do vary across CCOs. So CareOregon, for example, we have an entire team that's dedicated toward processing health-related services requests, and it's grown over the past few years as well. Whereas we've heard that other health plans, because they have fewer members, they don't have as much resources to actually have a full program for that. And so there might be 1 or 2 staff members. So I would say that it's a little bit difficult to really identify who the right person would be to go through. We found that with our partnerships with Adelante and Zenger, that having connections with our staff that work with grants was really a key way to kind of get their foot in the door, because they were able to build those connections with Sean DiCarlo, and then of course get their questions funneled through, like, does this fit in a health related services type of process? And my dog, of course, is barking again, so apologies if you can hear her. But yeah, so there's a lot of different ways that it can happen. I would say that there's really no wrong door. It's just about building connections. And I hate to be cliche and say that, like, you know, it's all about networking, but it really is. So I would say that, you know, my best advice is really to just be persistent and, you know, try to come up with a proposal about how your services could benefit the members that they serve as well. And I'm happy to, you know, work with whoever might want some additional assistance or review of program materials. Our team has been really diligent in trying to come up with materials and processes to make this work for CareOregon. And of course, I can't say that it will work in other CCOs, but, you know, we're certainly happy to help and provide resources as needed. That said, I will say that there's probably a much higher potential for new opportunities with the recent approval of the new 1115 waiver. And so we'll go into that in a moment. All right, so what is the 1115 waiver? So this is basically a waiver that allows states to get approval from CMS, the Center for Medicaid and Medicare Services, to modify traditional Medicaid requirements. It basically allows us to be a little bit more flexible and test new things beyond the scope of the current federal regulations. So we can try to expand the scope of who would be eligible for Medicaid, what benefits they receive, how healthcare is delivered, and a number of other things. But with health-related services in Oregon, that was implemented with the 2017 to 2022 waiver. And that was something that was really new and innovative for the state of Oregon and the country as a whole. And so we've seen that there have been a number of other states who are working on coming up with creative ways to offer similar things for members' social determinant of health needs. But I don't believe, I can't remember exactly, but I don't believe anyone calls them health-related services like we do. All right, let's see. So Regarding the new waiver, so this waiver has been approved as of this year. I don't remember the exact date, but it was approved for 2022 to 2027, I believe. And this is really focusing on a number of things. It's trying to improve health outcomes by addressing social needs that impact health. It's also trying to expand coverage for a number of different individuals. So you may have seen that there are members who would be eligible up to approximately age 26. There's a lot of expansion of possibilities here that we're really interested in learning about more. We've delved into some of the documentation and we still have questions. There's a lot of questions that have come up about what this waiver means and how it impacts health-related services. But one of the things that came up in this new waiver is a slightly differentiated type of health-related services. So when we're talking about health-related services, it's usually HRS or sometimes HRSF if it's health-related services funds or flex. But this waiver called out a new term, which was health-related social needs, or HRSN. Slightly different. Everyone loves their acronyms, right? So this one is really more about short-term post-transition services. So housing for up to 6 months and other housing supports, focusing on nutrition education and medically tailored food assistance, and devices to maintain healthy temperatures and clean air. So your air purifiers, your air conditioners, things like that. And this is really intended to help support members through those major life changes. So whereas health-related services are really focused on members in general, and they don't limit based on the individual life circumstances of the member, this is really intended to focus on those members who are going through something big in their lives, like disaster or weather events, such as perhaps what's happening now, loss of housing or healthcare coverage. There might be other things as well. So my understanding so far, and of course we will continue to learn about this as we get more information from the Oregon Health Authority, is that this is a little bit different and it's not intended to replace health-related services funds. And it's really something that is meant to support and supplement members' services when they are in the middle of one of those big life changes. So regarding whether it's going to be the same process, I don't know yet. We're still learning more. We've heard from OHA that it's likely that there will be more information coming out, of course, in early 2023, but we might not be implementing this until late in 2023 or early 2024. So I think there's still a lot to come regarding what this means for us and how we can work with CBOs and other partners to engage in these types of services. But I think that as CCOs and health plans start to understand what this can mean, there might be some additional opportunities for CBOs to step in, because one of the things that was called out in this was nutrition education and medically tailored food assistance. So I would say that, there's a number of things that could potentially be associated with that, but those are things that CCOs will want to prioritize as they get more knowledge of what health-related social needs are. We have obligations, of course, to the state to try to meet the new benefit requirements or waiver requirements. And so we'll certainly be working on trying to understand it as best as we can and engaging in new partnerships as we do. Let's see. So one of the questions too was about the language in the updated waiver stipulating a 6-month limit. And so I think that's, as I mentioned, really just related to that process of transitioning through major life changes. So my understanding is that it's not changing anything about health-related services in particular. Like the requests that we approve through different CSA programs and Veggie Rx programs have not had any sort of time limit on them. So we continue to approve, month after month, season after season, year after year for members, with, of course, a focus on sustainability and, what can we do to hopefully move a member forward and have them progress into, another type of service outside of Veggie Rx. But of course, it's not something that can be easily solved with one season of CSA boxes. Food insecurity is not an easy solution or not an easy problem to solve. So I would say that, we're continuing to try to focus on providing support past that 6-month mark. We don't anticipate that we'll be able to solve someone's hunger or food insecurity in a 6-month period. Let's see. And the last question that I wanted to touch on as well was about leveraging the 1115 Produce Rx flexibility statewide, as opposed to a select group of CCOs and organizations. And I don't know that I have a good answer for that. I've been thinking about it since Kaylee sent this question, or Shin sent this question. I'm not sure which one of you did, but this one is really tough because we have seen that there isn't as much alignment across CCOs, even with OHA, as we would like. But I think that through, organizations like this one, it definitely is helpful to have, common ground and try to work together with each other and with CCOs to try to figure out how we can come up with a more statewide approach. And I think now that there are there's more of a focus on food supports in particular with this new demonstration waiver, that might be a really good timing for us to think about a more statewide strategy. So I don't have a good answer, but I think that the timing is becoming more and more ideal as we go. Okay, so that's my presentation. And I know that there's some additional things in the chat. So I'm happy to answer any questions that you might have. I know I didn't provide a ton of answers to everything, but I hope this was helpful.
Thank you so much, Jen. This is extremely helpful. And as y'all know, we're also recording this session. So there are definitely folks that are maybe have power outages today or just couldn't be able to make it, and hoping to pass this along for folks there. I just kind of related to that question that you just touched upon. I think I see this as almost two parts, and I reread the question that I put in the chat actually, that it might be confusing. What I heard you say was that there's inconsistencies between CCOs of how they're interpreting, like how to utilize or implement health-related services, right? Mm-hmm. So there's kind of the CCO level and maybe inconsistencies of how even OHA is interpreting those guidelines, right? Mm-hmm. And then on the other side of this, which I think you were touching upon just now, is there's inconsistencies, or maybe it's not, inconsistencies isn't the best word, but there are differences in program models, whether it's a CSA or a voucher program or some other like medically tailored meal type Veggie Rx program that's being offered to communities in a very regional sense, right? And smaller programs. So I think that I guess my question is, what do you think it would take for CCOs, OHA to be consistent on how they're interpreting the health-related service waiver or system, as well as, and I think your answer was like, I don't know how, people would, or programs across the state would align their basic structure or model from the like program side of things.
Mm-hmm. Yeah, so it's really a challenging question. We've found that one of the benefits of CareOregon being positioned as we are is that we can create alignment across at least 3 CCOs because we oversee Jackson Care Connect and Columbia Pacific CCO, and we also participate in Health Share of Oregon. So there's opportunities for us to create alignment within our mini CCO collective, for lack of a better term. But that doesn't mean that that necessarily extends to other CCOs. But we have regular conversations with the other health share health plans to try to ensure that there's alignment, at least across the 5 health plans under that health share umbrella. I will say that it's still somewhat challenging. And so I think sometimes it takes more direct engagement and someone to be willing to make a decision about how something should happen. And I think that what we've seen so far is that sometimes there's some hesitancy to make a broad reaching decision. And that's true of many organizations, of course. I will say that it's the benefit of having the health share, health related services strategy work group has been that we can continue to connect and understand and learn from each other about what each health plan is doing. But we don't often get the same sort of insight into other CCOs or other health plans operations. So I think that, having larger conversations about what other folks are doing is always helpful. OHA often sponsors webinars for health-related services, and I would highly recommend any of those. They're really open to the public. So if it's something that you all are interested in participating in, you're certainly welcome to do so. In the slide deck, and I actually should have posted that, but in the slide deck that I had shared, I can find this again. There should have been a link to the health-related services webinar that is coming up. So let me post that in the chat here. Okay, so this is a registration link to the webinar that's going to be held by OHA in February, on the 1st of February. And so this one is specifically to talk about the new waiver and what will be happening there. So I think that's probably a really good opportunity to learn about some of the questions that are being asked and try to figure out where there are areas of alignment or consistency across the board. But I guess, yeah, to answer your question a little bit more directly, I think it's just about ensuring that we continue to work with OHA and with each other as CCOs to try to figure out what are the best ways for us to do this and how can we share more transparently with what each of us are doing.
Looks like Akiko, you've got a question.
I do. Jen, that was really great presentation. Thank you. I'm kind of losing my voice. That's why I was turning off my video. But so, I work for Kaiser Permanente, part of the Health Share Partners, just like you. CareOregon has Health Share Partnership. But, I try to bring the CSA programs and, somewhat we're kind of competing, but CareOregon has such a great programs that we just really cannot price match. So you mentioned about the CSA cost. Then there's administrative cost that seems to be almost equal or more than the CSA itself, which brings us to, I don't know if I should say the price, but just the price is a little bit not affordable for us. And then you say you have to be creative to fund the administrative cost. And how are you funding the administrative cost? And so I'm going to ask one more question just to pile them up. But second question is, we definitely had a lot of requests for housing related through the HRS, like rent assistance, utilities, or even mortgage payment, so that they can stay in place. And we just cannot fund both, right? Just I heard rumors that CareOregon does not have limit, but we do have limit just to keep it sustainable and be able to have that available for all members. So how do you do that? Like, do you have competing priorities? Or I'm just kind of curious your strategy to make that sustainable. Thank
Yeah,
you.
absolutely. Thank you. Yeah, so regarding our strategy, we have heard over and over again from HealthShare, and I don't know if this is something that you've heard as well from Kaiser, but from HealthShare, we keep hearing that we should be spending more on health-related services. And so we've kind of taken that to heart and launched forward with spending what we can on the services that we prioritize. And so health-related services and food supports has definitely been one of our priority areas. Housing, of course, has been a priority area as well. And so far we haven't really implemented too much in the way of limits. For housing, we have tried to keep it to about a year worth of housing related supports, but even that, depending on the individual member circumstances, can extend a little bit beyond that. For example, we had with the Jackson County fires in 2020, we had some members who quite literally needed housing supports for over a year. Some of them are still struggling with housing. And so it's not an easy solution. And we've really just tried to be as flexible as possible. We continue to work with HealthShare and our other CCO partners to just submit as much justification and rationale for what we're submitting in the Exhibit L report. So far, we have not had either HealthShare or OHA come back on us and say, you're spending too much. Usually what we're hearing is that we're maybe not spending enough. And so I think as we get more to a place of identifying that social determinants of health are more of a benefit rather than like a supplemental service, we might see that the amount of funding for that increases. So I guess I am curious, of course, that from the Kaiser perspective, like what is the messaging that you all are hearing? And you don't have to answer that now, but I am curious.
Just the full closure that I don't, that's something our Medicaid department manages. I partner with them very closely. So I'm more on the community benefit side. So we work together. But, I bring the program, we fund it or, and then, or bring like say Zanger Farm program to Kaiser too. But yeah, I'm just kind of curious. And CareOregon has more membership, of course, than any other partner. So, it might be slightly different allocation too. Mm-hmm. So yeah, but when I was talking with the community, and I think, most of you are probably curious about how to cover the administrative costs, because that's a serious issue to sustain the program, to have a successful CSA program or any nutrition program. I think you have to have the people. So it's not just the cost of the food, of course, the people, and then program needs to be sustainable. And that's what we've been asking the programs to do, to be sustainable and get out of the just relying on grants. So that's why I feel like, CareOregon's doing this by supporting the organizations. And I just wanted to find out about the mechanism of covering that administrative part too. So.
Well, and if you and I, or if you want to connect offline, I'm happy to delve into that a little bit further so that we can figure out how to be more aligned. But I will say, I know that there were at least a couple more questions in the chat, so I will touch on those in a moment. But I just wanted to say too, that one of the conversations that we've had within the HealthShare strategy work group for health related services is the topic of equity. Because we know that some health plans are doing things differently than CareOregon is doing them, and CareOregon is doing things differently than other health plans. And so trying to ensure that CareOregon members are not getting more services than they would at Kaiser or Legacy Health Pacific Source, et cetera. We are concerned about that because we don't want for there to be health plans that suddenly lose members because everyone is seeing that they're getting more services via food support at CareOregon, for example. That's not the intention of what we're doing, but it's something that we do have to be concerned about. And so that's been an ongoing conversation with the health share group.
I totally agree with that. I don't want to dominate the conversation.
Yeah.
I think I brought this up with, our partners, that it would be really nice to have the same benefit, especially social needs and food and nutrition, that to anybody, like all Medicaid members, regardless of where they live, especially if they're like under the same CCO. Like, of course, we have Trillium in the Portland area outside of health share too, but for members, it's so confusing who has what and access to which program. So I'm hoping the Medicaid waiver is going to flatten a little bit more those things, and it's a little bit easier to understand. And then also the community organizations, like a lot of partners in OCFS and partners, that they don't need to deal with a different access or different requirements or process. They just have one process to work with healthcare organizations in terms of Medicaid members. So I really appreciate that, and I love to connect, and I put my email address on the chat.
I appreciate that. Thank you. All right. So some of the additional questions that had come in, one of them was, how does the program work for federally recognized tribes? And can those funds be used for programs with tribal organizations that don't reside on federal reservations? And that is something that I'm not sure that I can answer in full. I can answer in part. So it's really dependent on whether the tribal members are enrolled with a CCO. If they are enrolled with a CCO, then they're very much eligible for health-related services. And then, of course, we can enroll them in these Veggie Rx programs. We do, as I touched on in the very beginning of the presentation, we do offer community benefit initiatives as well. And so there's possibilities that tribal members may benefit from health-related services in that way. We haven't specifically at CareOregon focused on tribal members and food supports. We do focus on their care coordination and also on their NEMT services, their non-emergent medical transportation services, but we haven't particularly focused on food supports or other types of health-related services supports, because technically most tribal members, well, actually, I shouldn't say most, many tribal members are not enrolled with a CCO, and therefore they would not be eligible for health-related services. So that's a little bit of a tricky area for us to address, but I think that there are certainly opportunities. Those funds can be used for programs regardless of where they reside. It just depends on what the CCO's involvement is and whether they're willing to consider tribal members who are not enrolled with the CCO under community benefit initiatives instead. I hope that answers the question. And I think that's it. I don't believe I saw any other questions unless I missed anything.
I don't see any others in the chat, but is anyone else on the call have burning questions? I wonder, Jen, sorry, I'm trying to hold my tongue back because I always have so many questions for you. But just to make the distinction between the 1115 waiver and health-related service funds, I know that when I was working with Adelante, sometimes that initial paperwork, when you were talking about the workflow or the the workflow from the program level and the patient level, that there is documentation that is filled out by the provider per individual member, right? Mm-hmm. And sometimes that's referred to as a waiver or like flex funds waiver. Mm-hmm. I think had been some of the original language there, and that is different than the 1115 waiver that we're talking about on a statewide level for like OHA's contract with Center for Medicaid Services, correct?
Yes. Yeah.
Okay.
When we're talking about the section 1115 demonstration waiver, it's really more the programmatic waiver that we've gotten from CMS, that OHA has gotten from CMS to basically experiment with Medicaid services and funding. The paperwork that we're talking about, we really just refer to that as the health related services request form. I didn't realize that anyone was calling it a waiver. I guess it could be a waiver.
And maybe that's a little bit of an outdated language. I feel like when we first started working with you, it was sometimes referred to as like flex funds waiver for that particular patient, but I will strike that from my language so that we don't confuse anyone else.
Sounds good.
Meredith, not to put you on the spot, but I know that you're here with OHA, and I'm curious to know if you have any insight or questions or things that came up from this discussion.
I'm so glad you put me on the spot. Thank you. Thank you. Jen, thank you so much for the presentation. I mean, I think this was really, really helpful. I work in the health promotion and chronic disease prevention section of the public health division, which is kind of different from the folks that work a lot on the Medicaid waiver. And I was actually just talking with colleagues this morning with chronic disease self-management, how can or should Veggie Rx fit in with that? Because I think pretty commonly there's this tension between how do we, those who very much support Veggie Rx, how do we build some infrastructure and some sustainability without taking away the nimbleness and the uniqueness of kind of like the region and community specific ways that Veggie Rx is delivered. And I think that there's not a great answer. I think as folks have been trying to engage with OHA around Veggie Rx, it's been bopped around from kind of person to person to person, and it's hard to find a place to help it live. I do think that there's an arm of this where chronic disease self-management, it kind of works. I also think in the state health improvement plan, we're trying to build some capacity for having just true nutrition security initiatives. And I think that's really the ideal home for it. Just, I feel so cliche being an OHA person being like, we're having capacity challenges, but it's, it's public health. It's, you know, it's a government agency. It's, you know, the COVID unit kind of closing down this month. So I think those are two potential, you know, points of OHA that can be engaged. But I think I just, you know, I'm hearing from the discussion earlier this week and from here that there's like, okay, how do we expand this so that a lot of folks have access to this? Mm-hmm. And there's a need for statewide, or there's a desire for statewide reach. And I think that means infrastructure and sustainability. But yeah, how do we preserve that nimbleness and uniqueness? And maybe that's more questions than it is answers, but it's like the discussions that we're having and trying to figure some things out.
Yeah, I think honestly, I share most of those questions. You know, how do we do that? And I don't think that there is an easy answer. I really appreciate your involvement and, you know, participation in this meeting. I think this is really helpful to have someone from OHA on board. And I'm so interested in learning more about like how we can make more intersections within other arms of OHA. So I would love to pick your brain a little bit.
Yeah. One thing I've been bringing up fairly recently is, you know, for larger scale Medicaid coverage, OHA has something called the Health Evidence Review Commission. That's how programs get approved for kind of statewide reach in a different way than the waiver works. And we've had success in the past getting pretty like innovative and great programs covered. Just for perspective, that is about a decade-long process, at least from our past example. But it did really require, at least from the OHA side, a lot of section-to-section relationships. What I'm talking about were movement programs that were kind of funded through arthritis management dollars, but ultimately got covered, and the evidence that was used to get them covered was in the name of falls prevention. But that required a lot of like internal collaboration to kind of navigate that really complex health system that is OHA. But that is an avenue, and I don't think it's the avenue by any means, but that's, I think, tied to the Medicaid conversation, and just kind of in the menu of options of how to engage and how to build sustainability and how to use OHA to get statewide reach. It's one. I think that there are others with chronic disease, tying it to chronic disease management. But really, I have hope too for this nutrition security piece of the state health improvement plan, but that needs to be built up.
Yeah, there's definitely a lot of needs to build up that infrastructure. So I can't wait to see what happens with this new waiver. There's a lot of really exciting opportunities and conversations that are going to be held next year.
Well, thank you again so much, Jen. We really appreciate your time and expertise and generosity with sharing CareOregon's process in this, and really being an innovative leader in an exemplary example of how you can work with CBOs and really create meaningful partnerships to affect greater health equity. So thank you so much. And thank you all for being on the call today. And we'll include the slides with the recording once that kind of gets uploaded here. So thank you so much, all.
Sounds great. Thank you all.
Happy holidays.
Happy holidays. Bye.
Bye.